I'm going to demonstrate some of the ball bunting procedures. A stick like this that has some different colors and some tape. The tape has been removed from here, and this has seen some better days, but it'll work for what we're looking for. You can use a broomstick as well. Meter sticks may be a little bit difficult because you probably want to use them to measure things. So this kind of stick is very good. The initial bunting activities, I want the hands symmetrically placed, and I want the person working to hit it in the center position. Now, I'm going to demonstrate first how we'd like to see it, and then I will demonstrate some of the things you will see some of our patients do. So, just nice and easy, and I just demonstrated one of the problem things, but we'll go back there. So I want a fairly healthy hit, and we have quite a few in a row. That at first we just start with straight bunting, okay? And one of the things we tend to see, we'll see the mini bunter, just a little tiny kind of thing like this, and they're afraid to put any force behind it. And I really want them to commit to hitting the ball. So it should be a nice hit. Now I'm going to demonstrate one of the things we see many patients do. I'm going to do it first, then I'll explain why it happens, or why we think it happens. So I'm going to strike it once, and it's on the return that you're going to see what they do. Now what happens there is they're making a distance or a height judgment of the ball when it's somewhere out on the arc. If you notice, as it comes out like this to the side, it's actually raising up, and that's because of the way this whole thing works. The ball is actually constrained to a certain position in space, and the further away from the center, the higher up it goes. So if the person is making a height judgment of where to direct the stick, when the ball is out at its extreme, they're going to be hitting well above the ball when it comes in. So part of this is also learning to predict where the ball is going to be in space. It will always be at the same place. So watch for that. I'll demonstrate that again. They'll hit it out. Second time, they get this little loop around. Now, you'll also at times see when they hit it, the ball begins to bounce, and you'll hear the string bounce. That's when they're hitting just above the center position or just below, and you're getting some vertical force directed into the ball. So I'll demonstrate that as well. Here, there's a lot of that pop and smash, same kind of thing there, if we hit below or hit above. So what you're looking for is a nice tangent hit like that that gives you good force and good direction. Now I'm going to demonstrate V bunting. The basic idea of this one is we're going to bunt the ball. The V pattern is, this is one part of the V, this is the other part of the V, so the base of the V is down here. And so that we have a good sense of what the person is doing, we're going to direct it 2 times off to one side, 2 times off to the other. A key ingredient of this, by the way, is if the person is not standing in the right place, it's almost impossible to do this correctly. The person needs to stand essentially when the ball is at rest, just behind that in the center position. If you're too far back, the paths of the ball will not come back to a single center point. So we start with 1, 2, and then redirect. 2, 1, 2, 1, 2. And that's the V bunting procedure that we're looking for. I'm now going to demonstrate the half circles ball bunting procedure. Once again, it's really important that the person stand in the correct position. That's when the ball is at rest directly behind it. Here we're going to start with the hands together. And generally, when I do this with a patient, I will pull the ball out and I will start it. I will even tell them I'm going to start it off to the side and send it to that side so they know where it is going to come to. Now I can self-start this as a demonstration, so again I need to come back to the correct position. I'm going to start here and I'm going to take it here. And by the way, on this one too, the interesting thing is people think they have to throw it to the side or hit it to the side, but the basic idea is if it goes straight out, the string and all the forces of nature are going to bring it to the other side. So all I have to do is start it straight out and then be ready to hit it with the outside part of the stick. And again, look it in. You'll probably see I am moving my head a little bit, and that's perfectly fine for something like this. So this is not a thing where we want the person to hold their head perfectly steady. Now the interesting thing is if they miss the ball, you can just let it go because it's coming around again. So I'll demonstrate that after 2 hits. I will intentionally miss the ball and we'll let it go around. Not enough force. Let's try that one again. Okay. And here it comes again. I can go right back into sequence. Now, when the person at the beginning hitting it anywhere along the stick is good, but later I want to see if the person can control going specifically just to the blue, blue, red, red, green, green, maybe green on this side to red on this side, so that one can increase the challenge in terms of making little shifts in the hands to meet the ball in various positions. So this is ball bunting, the half circles, and it's a wonderful activity.